the student leaders, Professor Ganeshwar Sethi, my dear friend CBK, Professor Bharuchi Das, and the beautiful introduction you gave for me. 50 years ago on this month, I entered the medical college at SCB. That was just half a century ago. I consider it's a privilege that you called me as guest speaker. No one has called me as a guest speaker, either in my state or wherever I served. I have never been a guest speaker. The only relief is that when the time allotment was given, it is the same time given to everyone. So the guest speaker do not have more privilege than what CBK had. Ladies and gentlemen, you are privileged to be a medical graduate. There are immense challenges hereinafter. Obtaining an MBBS degree is nothing. Life starts from here, and I am remembered by a small story of Lord Buddha. Lord Buddha, when he had attained enlightenment, there were 3 chamchas who were along with him. So each of these chamcha or the followers would be very kind to him. And believe you, Buddha knew that when he was going to die. He had not told that, but each of these chamcha, when they found Buddha alone, asked, I don't know what they would have called lordship, please tell me the secret of how I attained enlightenment, how you attained enlightenment. So Buddha was profoundly silent. Then he called all of them together. Hours before death, he said, you look at the forest. You have to build your path. No one, no guru, no book will tell you how you succeed. You have to empower yourself. No one. You can listen to teachers, read books, don't read books. I believe most of your fate lies with you. Genius in medicine is about 99% diligence and 1% intelligence. You are not a software expert. You can crack an app in your phone. You have to work hard, work hard, work hard. And remember, I spent maybe close to 40 years of life trying to learn rheumatology, immunology. I was the first one to start in this country. When I went to England after being tutored at AIMS, I was in AIMS as a research officer by Professor Malviya, who is also a great legend in this country. I went to Charing Cross Hospital and addressed to my guide, who is Professor Ravindra Maini, who is a 3rd generation Indian, much like what Rishi Sunak is. He moved from Kenya and they all moved there. He is the discoverer of anti-TNF therapy in rheumatoid arthritis. Nowadays, you know that the rheumatological disease, cancer, the treatment approach have radically changed. One thing that struck me, which was different from me than to an English graduate, is the ability to ask questions. It is your ignorance that you should be afraid of. Your knowledge is your knowledge. And if you know what you don't know, that is knowledge. So I asked him for a patient, "Sir, I don't understand this." He called me. He said, "Don't call me sir." He's a big man. In England, no one calls sir even to the professor, or they call by the first name. He said, "You can call me Tiny, and I would be happy to help you." So I asked a question, why did this occur? He said, "You try for one day, tomorrow you come back and I will tell you the answer." Means you first try to find out. The teacher is not there to tell, भाई इसका hemoglobin क्यों कम है. Patient होगा तो anemia है तो कहेंगे hemoglobin कम है. They will not give a ready answer कि ये करो तो ये हो जाएगा. He said, तुम भी सोचो. It is when you start worrying for patient, you become a transformed character. What CBK said is one thing that should get into your mind. No amount of knowledge would make you a good doctor. You have to first be a good human being and then be a good doctor. If you do not understand the money the patient has, your treatment, your advice are all useless. Today CBK told that the average patient who comes, they earn less than 15,000 for the entire family. What is this bloody nuisance of prescribing CT scan, MRI and all that? So unless you feel the pain of the patient, you can't be a doctor. The Harvard Medical School, the #1 medical school, how does it select students to be medical graduates? It is not based on MCQ question or your marks in the theory. That is one part. That constitutes 50% of your weightage to become a medical. Then you face an interview where 26 people will interview and they are judging one thing. They ask you, have you ever looked after any old parents? Have you ever gone to an orphanage? If your CV doesn't have that, you might be the top performer in your inter. They don't go after inter, they go after their graduate, BSc. You will not be selected by the doctor. There are in the interview board people who can assess you, your attitude to sympathize with other people. If you can't appreciate the pain of the patient, I can literally tell you, I have created 80 of specialties in my subject. But the good one is the one who don't leave the patient when he is dying. So if a patient is having abdominal pain, forget, you don't know what it is due to. No one knows exactly what is the cause of abdominal pain, a very common distress for which patients are seen in casualty. You have to sit by the patient and monitor the patient every half an hour. Call for the experts. Call for other specialty. No problem in medical specialty can be solved by you. Books are good, and you guys have a distinct advantage of the smartphone. What is latest is there in your hand. We used to have rounds where people used to quote Harrison में ये लिखा है. अब कोई ज़रूरत नहीं है. The third year or fourth year student would flip off the phone. ये कहेगा कि सर आप गलत कह रहे हैं. There is nothing wrong or right in the treatment of the patient unless the patient walks out of being normal. So, my thoughts that I would like to share with you, if your heart cries at the patient's face, then you have to think. And whenever you go to sleep at night, if you are in the clinical years, always carry the pain of the patient on your shoulder. You will wake up with an answer. Third thing is I know that for certain when I will be in deathbed, you will be my doctor. Because we trust the younger generation to look after us. So I expect you don't need to know the latest in medicine, but be with me. I don't want you to know the best medicine for Alzheimer's disease. There is none so far. But you understand that I am Alzheimer, I have run out of memory. If you feel that, that's all I want. I want your hand. I don't want your brain. Your brain is going to be clogged by enormous number of information. You would be confused by kya karna hai. And the numerous investigation tools that are coming, much of it is not warranted, like MRI in every patient with backache. You get ultrasound report. You don't treat investigational abnormality. You treat patients. We have every week a new autoantibody is being discovered. But patients are not diagnosed on the basis of autoantibody. Patients are diagnosed based on its clinical pattern. Finally, what CBK said, that remember, you are accountable to you are accountable to the organization, and you are accountable to the society. We had a lovely period of undergraduate. I did the first study of cardiac involvement in diabetics by doing endomyocardial biopsy. Believe me, that study would not be permissible in current world of ethics. You have to know the ethical values. And what ethical values is, I will give you a small example. I was a senior registrar in UK, and one 86-year-old lady who was drunk and was found in a wayside bench was brought to the casualties. My registrar called and we went. I made a fundamental mistake in my life. अरे 86-year-old कितना जीना है? 86-year-old और कितना जीना है? Society has not given you permission to decide your treatment that कौन बचेगा कौन नहीं. Every death in that hospital within 24 hours of admission, the head of the medicine does a coroner inquiry. भाई हमें तो पता नहीं था. The head of the medicine, head of the surgery and head of the investigation, they grill you. I thought maybe because I am not white skin, they are asking tough questions. Britain is known for its racism based on skin color. मेरे को I thought that एक क्वेश्चन पूछ रहा है, ये क्यों नहीं किया, ये क्यों नहीं किया, माने इटा कहीं करना सही था. Finally, the HOD medicine told me, Dr. Misra, her potassium was 19.5. Our normal values of potassium is 3.5 to 5.5, and if potassium level is elevated, one can have arrhythmia and die. So he asked me, would you have done the same thing if that lady was your mother? My entire orientation to medicine changed. So, students, patients teach us, patients are your own. By dint of some luck, favor of family, we have doctors, the other person is not. But he is either your brother, son, or your parent. It is immaterial whether he is actually not yours or not. If you feel that, you treat everyone not based on anything, not based whether you have money or not. Believe me, if a patient is poor, you can give the same treatment. CBK was telling that government gives enough facility now. So, students, you have chosen a career, you are gifted a career, but you prove that you are worthy of it by your hard work. And remember, never be egoistic. The patient that I lost in my life, where ego came into me and I thought I am correct. Patient will tell you, or the ghost of the patient will tell you, no sir, you had not known about this condition. Medicine is immense. After 50 years of practice, I learned from my resident, इसका आंसर ये है. It's a charm. The answer you have to read every day, you have to listen to every day, and listen to the concern of the patient. And in Western world now, you cannot write a medicine without what is called a shared decision. You have to tell the patient you have this problem, these are the medicine for you. It is your decision whether I prescribe or not. So the world is looking at you, and never be proud that you are a doctor. The moment you are proud, you are likely to do mistakes. Thank you, students.